Meet Cristina Cadenas, a nurse working at a university hospital in Madrid, Spain, one of the hardest hit countries in Europe. She was one of 10 health workers in her department to contract the virus and spent 1 month recovering from it before returning to work.
We all have a lot of contact with the patients because we are dealing directly with them. But I think that nursing assistants and nurses are more at risk because you deal directly with them practically your entire working day. You help them get washed, get dressed, and there's very close contact. Although my ward wasn't that complicated because it's a traumatology ward, there was an infected COVID-19 patient and we didn't know it. So I think that's where we all caught the virus.
But she's one of the lucky ones, with current estimates of hundreds of nurses dying from the virus, a profession that sees people risking their own health and that of their families to help save the lives of others.
Coronavirus around the world. If the average healthcare worker infection rate, about 6% we think, was applied to that, the figure globally could be more than 200,000 health worker infections today.
With persistent concerns that the pandemic is putting pressure on medical staff and health systems to a breaking point, especially in vulnerable and fragile settings.
We are still receiving reports of shortages of personal protective equipment, an issue not just for hospitals but for people in care homes or staff who are looking after people in their own homes as well. We believe that the lack of supply of personal protective equipment is related to the increase in infection rates that we have seen amongst healthcare workers. We think it's also highlighting that countries around the world were just not prepared enough. They didn't have the stockpiles of PPE. We went into this pandemic 6 million short of the number of nurses that we need as well.
Some frontline workers, like this Brazilian ICU nurse, have also faced a growing tide of hostility towards them after being verbally attacked upon entering a public bus in Sao Paulo.
I was leaving the service and entering the trolley bus, and when I got on the trolley bus together with 2 nurses, the passengers were extremely shocked because I was wearing a shirt written nursing. Then someone said our contaminated ones got on the bus. What did we do? We went to the end of the bus because people turned their heads and put on their masks thinking I was going to contaminate someone.
And while death to a large extent has defined the tragedy of this virus, it's the nurses and healthcare workers who've also defined the small victories amidst all of it. Here, dancing and celebrating the recovery of a patient who spent 45 days battling the virus in their hospital in Orange, California. Or this UK-based New Zealand ICU nurse who was publicly thanked by British Prime Minister Boris Johnson after he recovered from COVID-19.
All of our intensive care shifts are really tough for whatever reason. I think there was a lot of media interest about him being in hospital, and to be honest, that's probably was the toughest thing of the lot. As a unit, he was just another patient that we were trying to do our best for, so it was business as usual.
Essential workers to the core. And despite the obstacles they've encountered during the coronavirus outbreak, heroes to so many everywhere. Sherwin Bryce-Pease, SABC News, New York.